So we have a lot in store for you, and I'm gonna let her talk more because this is her forte.
Quick update on our pediatric complex care clinic at Omni Family Health. We're up and running, and yes, and we're very busy.
Yes.
We are now doing additional screenings with all of our families, and that's what we're going to be talking about today. Two types of screenings. One is what we call the social determinants of health screening. The social factors, housing, employment, childcare, utility assistance, etc., that can have an impact on your child's health. The other one is something called adverse childhood experiences. I know there's been a great building awareness of this in the state of California, thanks to our Surgeon General, Dr. Nadine Burke-Harris, who's very passionate about this.
She is, yes.
And it's important to screen folks for adverse childhood experiences because it can translate to many disease states, and it can lead to a premature loss of life. So we'll be talking about that as well. So at our complex care clinic, we are very fortunate to have medical students from Toro School of Osteopathic Medicine rotate through our clinic.
Yep.
And we have two exceptional students here today who will guide us through the social determinants of health screening as well as the adverse childhood experience. So I'm very happy to introduce both of them, and I'm really excited that they have chosen pediatrics as their future career, and I think they will make exceptional physicians.
And funny.
They are great, well-rounded kids for me. But so the first student today to talk about social determinants of health is Jonathan Junkar. He is a fourth-year medical student at Toro Medical School, going into pediatrics. It's been a great pleasure having him in our clinic. He has a wonderful bedside manner, and he enjoys playing with the kids all the time. He has two of his own, I'm told, two young children. Welcome, Jonathan.
Thank you. Thank you so much for having me today.
So let's start with defining what is social determinants of health.
Yeah. So as you mentioned, Dr. Rao, social determinants of health kind of frame the environment within which we live and within which we grow up. And that can include financial stability, it can include housing, transportation, whether or not we have safe places where we can go out to exercise, all those things that affect our lives in ways that we don't see directly, but have very large impacts on our health as a whole. That's what we kind of consider as social determinants of health.
So as a medical profession, I mean, we're starting to address this as part of the health management of the patient. What would your message be to caregivers who are struggling with these basic elements? What would your message be in terms of finding appropriate help?
Absolutely. So at the outset, it can be really daunting when you have all these different factors that all seem to interplay with each other, preventing you from being at your very best for your child. And we as healthcare professionals are here to help. We are people you can turn to, that we are people that can give you resources that you may otherwise not have known were available, and help you get connected to organizations and different resources that can help you
Provide coordination of care.
Yeah, provide coordination of care, and also just have that stability to kind of back your efforts and help really elevate yourself and your child in terms of reaching their full potential.
I couldn't agree more. I mean, and when you have a child with a serious or chronic medical illness, imagine that having the threat of eviction, not having enough food to eat, not having transportation that is stable to take your child to appointments.
Yeah.
Often in the medical profession, all we see is a parent not showing up for their appointment.
Yeah, I know. Not the reason why.
Exactly. We often don't take the time to understand why that is. And honestly, I don't think we've been great about supporting the families with these needs. But I definitely see a change. And I'm very proud of our next generation of physicians who understand this dynamic. There are many screens we can use to kind of assess the needs of a family. We are using the AAFP screening, but there are so many screenings and they all screen for the same thing. And then depending on the results of that screening, we can identify the needs and we can help link our families to appropriate resources in the community and link them with our community partners. And supporting the family always translates into better health outcomes for their child. Right.
Mm-hmm.
Now, as a caregiver, what would you add to this, Shauntiel?
Just the importance of knowing that your doctors are there for you.
Yes.
I think is a weight lifted. That's what I think. Just the understanding that you understand what we're going through.
Well, thank you, Jonathan, and best of luck to you. I'm sure you will do wonderfully.
No, I know he is.
No, thank you.
And next we have another fourth-year medical student from Toro University School of Medicine, and that is Miss Antonia Molinari. She is a future pediatrician as well. Antonia spent a great deal of time in our clinic helping us with many different things. She's helped us figure out ways in which we can do our SDH and our ACEs screening, kind of incorporating them into our workflow. And she did a wonderful presentation at the Kern County ACEs Symposium talking about her work. So welcome,
Thank you very much. I'm very happy to be here.
Thank you for your contributions to our clinic.
Yes.
So let's talk about ACEs. What does that mean?
So ACEs stands for Adverse Childhood Experiences, and they're kind of a group of different events that could happen to a child throughout their childhood. The main categories being abuse, neglect, and then household instability, with some subsets within those as well. The reason that we are looking at them is because there's been a lot of research showing an association between the stressful events in childhood leading to poorer health outcomes or a higher risk of poor health outcomes in the future if not addressed during childhood or early on when they happen.
Yes.
And how does that happen when you have adverse childhood experiences? How does that translate into poor health, higher risk of diabetes, asthma, and all that other stuff? How does that connection work?
So the way that they've been studying it, because it's this new, a lot of research is going on right now, but what we've learned so far is that there's something called toxic stress that leads to something called higher cortisol levels, and cortisol is a stress hormone that affects all parts of your body in the way that your cells grow and divide and remodel. And the fancy science speak that it is, but overall it just makes your body a little bit less adapt to handling different environmental changes or different changes in your body, say someone who doesn't have as high cortisol levels would do. And so they're finding that association with ACEs as well.
Absolutely. And then, it can be diseases that have nothing to do with stress.
Right.
It can translate to poor health and also decreased lifespan is what we're learning.
Yeah.
So what types of ways in which healthcare providers can address ACEs?
Well, the first way is to identify those at risk and increase awareness of what ACEs are within the community. The more people are familiar with ACEs, the more the healthcare providers can do to those who want it.
The more we don't flip out on you.
I wouldn't say flip out, but we will less surprised when it comes up in different office visits. But once identified and starting to be more aware, providers can screen. We use the Pearls ACEs screening tool, which has a wonderful layout that a lot of clinics can use and offer. And we can use it to screen parents that are interested or would be willing to complete it. And once we get we use the tool to assess how high of a risk the child has. Specifically, a higher ACEs score is associated with worse or a higher risk of worse health outcomes in the future. And so identifying it early, which we can do in the healthcare setting with the screening tool, allows us to connect them to resources early, connect them to support emotionally and, well, physically if they need it, support early to kind of address the toxic stress that might be accumulating in their body before it continues to build over time.
And what is your sense of, I mean, if I have a high ACEs score, does that mean I'm doomed? Does that mean, like, forget it, I'm gonna die, I'm gonna get all these diseases, I'm gonna be a mess,
I'm gonna be on these meds.
mentally and physically?
Mm-hmm.
So what does it mean when you have a high ACEs score? What can be done about it?
So a common misconception and fear that a lot of parents have, at least for their children, is, like you said, am I doomed if I have a high ACEs score? Is my fate sealed in terms of having a lower lifespan, having these poor health outcomes like asthma, diabetes? And the answer is no. I can understand how scary that must be, and so education prior to screening can be very important.
Yeah.
But identifying it early is very promising for these children and these families, because the earlier you identify it, the earlier you can address it, and you can kind of instill a lot of these more positive childhood experiences to kind of mitigate and address the toxic stress and hopefully resolve most of it so they're able to cope with different stressors in their life in the future by addressing your ACEs early. So if that kind of makes sense. There's a bunch of resilience within children. That part of the reason I chose pediatrics was because of the resilience in kids. They are so built to be able to withstand anything when given the right environment to thrive. And addressing that within childhood can make very promising outcomes for these children in the future.
So this is why I feel that it's very important, along with your screenings, for all the other things that we do when we see children in the primary care setting. These are some of the reasons why it's very important to incorporate social determinants of health screening and ACEs screening in our practice.
So don't be scared when you get the little form. It's okay. They're trying to help.
We're not trying to be intrusive. We're not nosy. This is a gesture on our part to show you that we do care.
Yes. Mm-hmm.
And we want to help. The questions themselves can be a little bit intrusive, and even reading them myself, I felt a little bit like they were kind of intruding into my personal life. But the reason that they're asked that way is to not have any type of what's the word?
Ambiguity?
Yes, thank you. Words are difficult. We don't want there to be any concern or questions about, is this really what they're asking? Is there not? So the questions are very direct to try and prevent that. But honestly, just the information we have, the sooner we have it, the more we can do to help the child and their families as well.
Yes.
These screenings are absolutely confidential.
Yeah, that's probably what they want to
And
know.
they have nothing to do with the reporting anyone to any place that's a social service agency,
That's that bad
etc. No, these are confidential and used exclusively for healthcare maintenance and guidance.
Mm-hmm.
And there's a lot of resources already available online for parents that may not be ready to address it in the clinical setting yet. Through acesaware.org, they have self-care tools and different activities that parents can do to help their child through these different stressful times that may be out of their own control, like increasing mindfulness, having more family time, like dedicated family activities, decreasing the use of electronics around the families, having those specific one-on-one time with their children, if applicable, and just having those types of conversations that can kind of mitigate the toxic stress factor with some of the negative events. So there's so many things that can be done that are the clinic and the providers can talk to parents about, as well as if parents want to look it up on acesaware.com, they have some tips and tricks as well.
So can you repeat that website again?
acesaware.org.
That's the site you go to.
ACESaware.org. Yes. Well, a pleasure as always, Shauntiel, and
I
thank
like our
you.
friends.
Thank you for having
Thank
me.
you for giving us this opportunity to present to you some of the new things that we're doing and to help improve awareness.
I think the family should know that this ACEs thing is not bad. And that it's okay to answer the questions.
Yes.
It's okay to talk to your healthcare professionals, and it's okay to know that they're, there to help.
Yes.
Mm-hmm. So what you guys are doing is good.
Thank you.
Thank you.
So we shine light on that.
Mm-hmm.
So what I wanted to do was did want you to talk about the type of cases that you serve at your at Omni.
So we just started a pediatric complex care clinic. It is designed for children with multiple medical issues. Technology dependence is what we call them, if they've got a G tube or a breathing tube, or they depend on breathing treatments, oxygen, you name it. Where the families are struggling a bit trying to provide a care for the child, and they're not necessarily aware of what's out there in the community to help them. These are the kind of children that we can help by supporting the family, linking them to services, and providing a primary care level of reference where they can go to help them problem solve. So those are the kind of patients that we can most definitely help.
Yes, I want to shine light on that because so many people don't know where to go to find good care. So I wanted to make sure that the parents and the people who are watching know that there is a medically complex place where they could send children or refer so that they could have access to these services that you guys are all talking about.
Well, thank you. Thank you so much.
Thank you guys for watching. We will see you guys in the next video, and we hope that we could share something with you guys and teach you guys something. And also, if you are some of our community partners, we hope that we did well by you guys, and you guys are watching and you guys want to join in these videos too. We will see you guys in the next video, and thank you guys for watching. Don't forget to hit the like and subscribe. See you guys in the next video. Bye.
And thank you, Jonathan, and thank
Yes,
you, Annie, one
he's
more
over
time.
there. Yes.
Thank you.
Bye, you guys.